Hi, I'm Dr. Christopher Allen. I am one of the orthopedic sports medicine people at the Rothman Institute, and I have been a member of the NAC since it was a racquetball club back in the 90s. So I've been familiar with the NAC for quite some time, but Rothman has had a relationship with the NAC for the past several years. And one of the perks of being a NAC member and Rothman working there is we have a hotline where you can call and get in quickly, as opposed to going through the switchboard, which can sometimes be almost as tedious as calling the IRS. So the cards are everywhere in the club, but if you can't find one, come to the front desk and they will have the card, and it has the phone-in number to get VIP access. And we can usually get you in, we have 4 days a week we're in the Newtown office, but I'm in Newtown, Bensalem, and 2 offices over in New Jersey. So we can get you in pretty quickly if there's something comes up and you need to be seen, or if there's a competition or a race or something and your time frame is kind of compressed a little bit. Or you're getting married next week and you have to leave on a honeymoon to go somewhere. So we can take care of all of that. So anyway, so I guess we're doing Facebook Live tonight, so we have a bunch of questions and we'll try to run through them. And I guess if there are people who are live as well, they can add to the questions that we have, and we'll see what we see.
Do you want to tell a little background of your specialty?
Oh yeah. So I'm a sports medicine physician who until last year operated, but with COVID, one of the calamities of COVID is I went from operative to non-operative. But I've been seeing and treating orthopedic patients for almost 40 years. I primarily with sports, but now see a little bit of everything, spine, ankles, what hurts we see. Orthopedics is, for those who might be chiming in, one of our questions was, what's orthopedics? And orthopedics is the treatment of conditions of the musculoskeletal system. So it's bones, joints, muscles, tendons, pretty much anything that hurts we can take care of. Sometimes with surgery, but a lot of times it's things that we can take care of with non-surgical methods, whether it's medication, physical therapy, exercise. And the great thing about having somewhere like the NAC nearby is that everybody can get back into their exercise once we sort of train them back to where they need to be. So, and so I see patients 5 days a week, and like I said, 4 different offices. And hopefully we get people back to doing what they want to do. I think the motto is, be what you once were. I think there you go, be what you were. And we can help you do that. We can't make you any younger. We're working on that, but we can make you feel a little bit better.
All right, so first question. For what types of reasons would I see an orthopedic specialist?
Okay, so the question is, what types of reasons would I see an orthopedic specialist? Pretty much any, we talked about it's the musculoskeletal system, so it's bones, joints, soft tissue, tendons, but anything that either hurts bad enough that you can't function on a day-to-day basis, whether it's in the gym, at work, or your recreation hobbies. B, anything that causes swelling, anything that causes sort of bruising and discoloration. Some of these things people will go to an urgent care and ER, but anything that starts to interfere with your function, whether it's too painful to use that joint, whether it's swollen, stiff, black and blue, discolored, but pretty much anything that's starting to interfere with your day-to-day activity, whether it's work, fun, or otherwise. So, and we can see sort of top to bottom, whether it's the spine, the back, the knees, ankles,
Okay. That could lead into this question. When should I heat an injury versus ice? So you mentioned swelling.
So the question is, when should I heat versus ice an injury? Ice is always the first choice. Immediately after an injury, ice will help keep down the swelling. And unfortunately, we tell people, put it on for 20 minutes, take it off. We have seen people who have fallen asleep with ice on, and they actually can get frostbite. I had a quarterback from one of the local schools years ago fell asleep with ice on his elbow and actually injured the nerve, so he couldn't grip the football, and he ended up playing defensive back instead of quarterback that year. So we tell people 20 minutes on, 20 minutes off, unless it's one of those cooling things that's putting cold water through, or an ice pack that's going to warm up. But a bag of ice, you never want to leave on for more than 20 minutes because you can get some thermal damage. And alternatively, once you've 2 or 3 days down the road, if you have some stiffness as opposed to just pain, heat sometimes helps to get the blood flowing. So we like to tell people, if it's painful, ice; if it's stiff, heat. And sometimes you have to toss a coin. Sometimes you have to figure out, what to do. Usually before a workout, you want to warm up, so heat is better. After a workout, you want to cool down, so ice is usually better.
Preventing ACL sports injuries. Someone's daughter plays soccer. She's had tear in both of her knees, so what's the best way to prevent?
So the question is there a way to prevent ACL injuries? Is there a method? We do know that female athletes, particularly soccer players, tend to have ACL injuries at a higher rate than the male counterparts. We also know that a lot of these injuries are non-contact injuries. Usually the non-contact injuries are landing on an unbalanced leg. So whether it's somebody making a quick pivot, whether it's somebody coming to a jump stop to shoot a basketball or to kick or fake out somebody, that moment of landing on an unbalanced leg sometimes can be enough to tear the ACL. There's a whole science of what we call plyometrics or jump training, which some started in Cincinnati. There's a program out of UCLA, but they're called jump conditioning or jump training programs. Actually, P90X has a jump phase of their P90X. A lot of these things can teach you how to jump better, but the concept is that they teach you how to land better. And landing better, landing on a more balanced leg is the key. And so they have found that people who go through a 6-week session of jump conditioning or jump training or plyometric training have a significant decrease in the incidence of ACL injuries across the season and across a career, because they have learned how to land better. And so I would say that if anybody has a worry about that, has had a history, like a parent who has had an ACL. I unfortunately saw a girl who she was in for an ACL injury. Dad had torn his ACL. I had torn my ACL, and they were all soccer injuries. And so we had the whole group of us was like, well, what did we learn? But the point is that if you think like dad's had an ACL, mom's had an ACL, I'm worried about this, a lot of the physical therapy places in this area are familiar with it, or you can look it up online and find the exercises, but doing a jump training program is what I would recommend, and they've been found to be highly effective in reducing. They'll never eliminate it, and a lot of the ACLs are just bad luck injuries. Somebody gives you a little shove going for a 50-50 ball and you plant wrong, your momentum's going one way, and sometimes that's all it takes. But a program like that is definitely helpful.
Switch over to the back. How to release lower back pain while working out?
So the question is there a way to release lower back pain while working out? Well, that's a tough one. The easy answer is there's a lot of things that can cause back pain, and most of them are fairly simple, and one of the best answers is to go back to working out. Get your heart rate up, get your core temperature up, do things that you want to do, and often the back pain will take care of itself. On the other hand, there are some conditions that can cause spasm, stiffness, a herniated disc. You're not going to work out with just exercise, and certainly there's some arthritic conditions in older athletes that can be a problem. The key is that stretching and flexibility, hamstrings and low back are so important, but you want to do that after a warm-up period, even whether it's just getting in the sauna or the steam room to kind of get warmed up. But if you have stiffness in the back that isn't getting better, sometimes that's one of those things where you see the orthopedic doctor, maybe start with a physical therapy routine that then you can bring back into your normal routine. Often the back pain that develops because of training is because of training wrong. So you see people hyperextending their back to do a bench press that they should be keeping their back flat, or lifting up a weight or doing a squat with a weight that's maybe a little too strong. I unfortunately saw a woman recently who is a power lifter in her 80s, and she was getting back pain, and she wanted to know, was there any simple solution? And I'm like, how much are you lifting? And she was like doing 2 1/4 at 81, so it was pretty impressive. I said, maybe back off on the weight a little bit. And I don't know if you know too many power lifters, but that was the most insulting thing I could say to her. And she was so upset, but I'm like, well, not forever, just back off for a little bit, and then you can kind of ease back into it. But I said, maybe tone it down just a little bit. So often they're just errors of training. And so the most important thing is to say, look at what you're doing, look what's causing your back pain. And then maybe we just transition a little bit to back to normal exercise. But that's one of those things where if you're having a lot of pain and it's an issue, that's one of those times to come in and see us.
What kind of physical therapy can my daughter do after 2.5 years of pain following a Lisfranc fracture?
Real good question. The question is, what kind of physical therapy can be done for a Lisfranc injury? This is a patient who said they've had a Lisfranc injury and it's 2.5 years later. Go back to your doctor. Lisfranc injury is an injury across the top of the arch, and so it's where the foot arches, and so it's an area where the forces are very concentrated in the foot. And if you've had a Lisfranc injury that has not healed properly, you will still have pain. And sometimes if you had a Lisfranc injury that healed properly, you can still have pain. And sometimes, components of the Lisfranc injury were missed and not treated properly. Sometimes maybe surgery is needed. So I would say that if it's 2.5 years after a Lisfranc injury and it's still painful, you need to go back to the doctor and find out why, because they can be devastating, and they often there's a solution, but sometimes if you haven't had surgery, sometimes maybe surgery is needed.
How about for the Achilles, stretching and maintenance for the Achilles?
For the Achilles, so the Achilles is one of those things that we know that most of the Achilles tendonitis, most of the Achilles strains can be taken care of with therapy. And if there's a tear, that's a little bit different, and we'll go to that later. But if it's a strain or tendonitis, stretching is very good. And everybody sees the classic wall stretch, where leaning up against the wall and pushing against the wall. Well, that's good, but the exercise that has been found to be most effective is what we call an eccentric stretch. And an eccentric stretch is where you're either on a step or on a box, and you're allowing the heel to dip first, so we're getting that stretch, but we're kind of slowly guiding the heel down, and then you do a toe raise. Okay, the machine over in the corner is excellent for that because it's got a bar where you can stand on it and eccentrically drop, and then concentrically go up and push up and do your heel raises. So an eccentric stretch like that is the best. And like I said, you need a step, a wall, a bar, or the machine over in the corner. And consistently. The second part is that a lot of these things are because the calf muscles are weak, and so the toe raises can help strengthen the calf muscles. But again, if it's something that persists or lingers and it is not getting better, that's when you come in and see. Sometimes you'll get swelling in the heel cord area, the Achilles tendon area, and sometimes that represents a partial tear. Complete tears feel like somebody whacked you in the back with a tennis racket or a racquetball racket. And there's a lot of pain, a lot of swelling, a lot of bruising, and that often is a reason to come in. And often the ones that have torn acutely down at the ankle need to be fixed. And so again, that's one of those things where it's a separate situation. You should come in. Tendonitis in the Achilles, great thing to put ice on. But warm up, stretch, ice down afterwards.
Knee pain during running, how to prevent it? What do you do if you feel it?
A lot of different, the question is knee pain when running. Well, a lot of things can cause knee pain. Okay, so there's simple knee pain where a lot of people get, which is in the front of the knee, and it's probably worse with up and down hills, and that's usually a question of what we call patella, condylation of the patella, or a little bit of early sort of wear and tear behind the kneecap, particularly in an older athlete, although we do see it in sort of younger athletes who haven't developed the muscles in their leg. The kneecap is a force concentrating area in the knee, and so when we're doing things, we can develop a lot of pressure in the knee. One of the things that really aggravates it is either going downstairs or going down an incline. And when you do that and have pain in the knee, that kind of tells you that it's the kneecap. If there's arthritis or cartilage issues, that's more along the sides of the knee, and that can cause clicking, catching, sometimes buckling of the knee. The key there is it will usually cause swelling. Most of the things we see, though, are going to be the kneecap related ones. And the thing that I see most in runners is that they spend about this much time stretching their hamstrings, and the hamstrings are usually very tight, and you have to convince them that hamstring stretching is going to make a big difference because it takes the pressure away from the knee, it takes the pressure out of the kneecap. And so I would say the most common thing is the kneecap stuff, and the best way to do it is to stretch your hamstrings. You know, stretch your quads too, but hamstring, if you have that 2 seconds to stretch the hamstrings.
What do you recommend as treatment for people who have SI joint dysfunction?
So the question is, what do I recommend for people who have SI joint dysfunction? Interestingly enough, SI joint dysfunction is one of those causes of sort of lower back pain that is not diagnosed as often as it should be. It kind of hides in there, particularly in women, female athletes, or people working out who have had babies. You know, because the SI joint's not designed to move, but after you've had 1 or 2 pregnancies, the SI joint gets a little mobile. And so often this low back pain is coming from the SI joint. Sometimes when people have arthritis of the knee or the hip, the forces transmit up to the SI joint. So a lot of that sort of low aching, deep low back pain is SI joint related. This is one of those instances where physical therapy for sort of core pelvic strengthening exercises is excellent, but range of motion of both the knee and the hip has to be incorporated, because if the hip is getting stiff, the forces are going up into the SI joint. There are some SI joint belts that you can wear that stabilize it. Sometimes if there's a lot of pain, occasionally recommending for an injection of cortisone into the SI joint. But that's a specialized injection and has to be done under fluoroscopic guidance, and so it's not something that we do all the time. But the short answer is core pelvic strengthening exercises, and not the Kegel exercises that everybody think pelvic floor exercises, but core. So it's the hip rotators, the hip flexors, all those muscles that cross the hip joint, but also cross the SI joint. If you work to strengthen them and improve the flexibility around the hip, it goes a long way to making the SI joint feel a lot better.
Someone says you work on his shoulder. You're the best. So that.
Well, thank you.
Rotator cuff. Someone mentioned rotator cuff.
Okay.
Rotator cuff tears.
So the question is, what about rotator cuff and shoulder pain? Well, there's a lot of shoulder pain that's not rotator cuff. I like to use the analogy that the rotator cuff is like a pair of blue jeans. And as the blue jeans get older, we start to get those little white spots where the knee is wearing thin on the blue jeans. And that's what the rotator cuff does. It thins out as we get older, and sometimes we start to see those little white fibers in the rotator cuff, and that's a partial injury. And often partial injuries can go completely fine without pain, without a problem, but sometimes they do tear. A lot of times, though, the pain that we have in the shoulder is just bursitis over the rotator cuff, and usually that's from training errors. Doing, again, I saw somebody who's doing overhead, kettlebell lifts, and they're a little too heavy, maybe a little bit arm position being too high. So it depends on whether it's pain that has developed after a workout and is only there when you're doing a workout, or pain that is persisting, pain at night, pain that makes it difficult for you to raise your arm up because the arm is weak. So you have to distinguish between something that's just painful or something that's causing weakness. Something that's painful can be worked out. We want to make sure people have range of motion. We want to make sure the muscles in the shoulder are balanced. Often there's weakness in the upper back muscles, the scapular core muscles, and getting the strength back in them will help balance the strength in the front of the shoulder. Again, that's one of those places where if you have a lot of pain, being evaluated, maybe going to physical therapy and then transitioning back to your exercise routine is helpful. On the other hand, if you have a rotator cuff tear or a labral tear or something that's more structural, your function is going to start to be impaired. You're not going to be able to throw a ball over hand. You're not going to be able to do work over hand. You're not going to be able to shovel or do the things that you need to do for work. In those instances, again, that's where we start to say maybe you need an MRI. Maybe we need to look at the tendon closely to see whether it's just the white fibers in the front of your jeans or whether you've got that tear that has come through that area of weakness. But a lot of these things are sort of just errors of training, particularly in younger people. Very rarely we'll see a rotator cuff tear in somebody under the age of 40. On the other hand, usually over the age of 60, most shoulder pain has some sort of injury to the rotator cuff. So it's that gray zone, 40 to 60, where we really want to pay attention to whether it's simply pain or pain that's interfering with function.
What's the recovery like for rotator cuff tear repair?
the question is, what's the recovery like for rotator cuff tear? And it depends on how big the tear is, and that's why, again, if you think of the blue jean analogy, if we're just fixing the white fiber with a little tear, a lot quicker recovery, and we know that your return to normal is almost 100%. If the tear gets big because we've kind of ignored it for a while, recovery can be 4 to 6 months, and you kind of get back to 85 to 90%, but you never get that 99, 90%, 100% recovery. So that's why diagnosing it early and treating it properly, and the people are like, oh, can't you just give me a cortisone shot? Well, you kind of want to make sure that you don't have a tear before you put cortisone in, because cortisone can affect the ability for the tendon to heal. So yeah, so it can be a variety of lengths. If you catch it when it's small, 2 to 3 months tops, and you're back to everything. If it's a big tear, sometimes you can't fix it. So.
Growing pains in kids.
Growing pains in kids. Good question. There are some things that we have names for. We have one called Osgood Slaughters, which is where the knee is growing at the front of the patellar tendon gets some pressure. Seaver's disease, where the Achilles tendon is attaching to the heel. And these are pains where the bone is growing sometimes a little fast, and the kids are putting a little bit too much pressure against it, and we get some very localized pain in those areas. On the other hand, there are some pains where the bones are just growing faster than the muscles and tendons can keep up with. And so we know that you go through this phase of rapid growth, and because they're growing fast, they're a little more fragile. So we see little leaguers' shoulders, we see stress injuries that occur in those areas. On the other hand, sometimes we see when the growth plates are just getting ready to close, sometimes there's pain just because they don't close all at once. Part of the growth plate is closing while part of the growth plate is still open, and so it's that unevenness, and you can't make them close too fast, and you want them to grow as long as they want to grow, but sometimes you kind of got to pull back a little bit when you're in this phase. It's a reflection of the normal function of the growing bone. The problem is, the kid comes in and he's got Osgood Slaughters disease, and he's playing baseball, and he's on a lacrosse team, and the soccer has just started, and it's like that 81-year-old power lifter. You tell him pull back just a little bit, and it's just like, which practice am I going to give up? So sometimes they have to pull back and rest a little bit. And the problem is, you tell these kids, the good news is it means your bones are growing. The bad news is, as long as your bones are growing, it's probably going to hurt a little bit. But that's, again, where one of the earlier questions, where ice after practice is sometimes not a bad thing to do. One of the people that were talking about Kobe Bryant after he died said that when he knew Kobe when he was in high school, and after practice, Kobe always iced his knees. And a 15-year-old saying to another 15-year-old, well, why are you icing your knees? He's like, because I want to play for a long time, and I figure I've got to start taking care of myself now. And so it's good enough for Kobe at 15 years old. It's good enough for a lot of kids at 15. But again, that tells you the value of ice after exercise.
That was the last question.
That's the last question. Oh no.
The closest location to the NAC, obviously.
Okay, so for those members of the NAC, the closest location of Rothman is just down the street next to the farmers market. So just go down Washington Street, make a right at the farmers market, and we're right there, right next to where they're putting in Five Guys. Not that we're going to recommend Five. They got rid of Salad Works and they're putting in a Five Guys. So we went from like one of the healthiest places to eat to one of the ones that's probably the least healthy to eat. But they do have good hamburgers. I must admit. Get the junior burger; it's smaller. So yeah, so we're probably only about 3 miles away from here. So you could walk it if you want the exercise. So. Anyway, that's it. Well, thank you for tuning in tonight. I guess we could do this again if people have questions. Maybe plan it, after the start of the new year, and go ahead and do that. I don't know how often we go live on Facebook, but it's not a bad thing. Yeah. Great. Well, thank you.